Now your breasts have a tuberous shape, which we also refer to as goat breasts. I'd like to talk a bit about the characteristics of this type of breast. Normally, a person has a breast structure like this, even if it's small, right? But yours are like this, separated in the middle. In fact, there is a certain amount of tissue deficiency here. One of the most important characteristics of these breasts is that they are separated in the middle. Secondly, when viewed from the side, the normal distance from the nipple down to the lower breast fold is about 5 to 6 centimeters, but your breast looks more like a bud. The distance here is approximately 2 to 3 centimeters. That's 1. That's 2, and this is 3. What is the third characteristic? The size of the areola, the brown part around. The nipple is normally expected to be smaller when the breast is small, right? But in your case, it's very large compared to the overall size of the breast. So, what needs to be done here? First of all, during surgery, we need to bring them closer together, in other words. Close the separation in the middle of the breasts. That's the first step. Secondly, we need to lower the inframammary fold. If we don't lower it and place the breast at its original fold, the breast will sit too high and look like a torpedo breast, which would be a very unattractive appearance. So what will we do? We'll adjust the position of the fold and lower it. When we lower the fold, what happens next? From a side view, the point where the fold meets the skin is the thinnest part. Since the fat tissue in that area is reduced, you may see a bubble effect, which is called a double bubble. Over time, this will improve. Will it go away 100%? No, but it will improve by about 90% to 95%. This is important. The second issue is the size of the nipple. In some patients, it can be so large that it looks like a bottle nipple at first. Later, it tends to shrink naturally over time. Alternatively, we could reduce it by making an incision around the areola, but I prefer to avoid that, especially for young, unmarried, and childless patients. So, you need to understand this. We have to use a large implant because you have tight skin and a broad chest structure. A small implant wouldn't work in this case. We'll use a 400cc implant. Even the lower length of this implant is not 2 to 3 centimeters. If we measure it here, it would be about 6 to 7 centimeters. So we will lower the breast. Initially, there may be a slight double bubble appearance, but this will improve over time. I won't make any adjustments to the size of the nipple because I expect it to settle naturally over time. I know this from experience. You can be confident about that. The only thing I ask from you is patience. Healing in these types of breasts takes a bit longer. Sometimes patients look at their breasts right after surgery and say, "Oh no, my breasts are still separated." But we always explain that this will settle with time.